Mr. President, I rise today with a group of my freshman colleagues to discuss an issue that is on all our minds, and I know the minds of all Americans, and that is the issue of health care reform. Now, the subject that most of us are going to address today are what happens if we do nothing on this critically important issue. Because we, as recent additions to this body, are united by a simple but important truth, that the rising cost of health care is hobbling American business, stressing family budgets, and if we do nothing and it is left unchecked, it will explode our national debt. And one of the things I urge my colleagues to consider, while many have raised important and valid questions about some of the health care proposals, one of the things that I hope all my colleagues will realize is that doing nothing in terms of reforming our health care system is a policy choice. It is a misguided choice, an irresponsible choice, but it is a choice nonetheless. Today, health care costs in America consume nearly 17% of our GDP. This is projected to grow to one-third of our GDP by 2040 if we do nothing. This chart here shows this ever-escalating cost of health care. It shows as well as a percentage of our GDP. Here, we see the cost in actual dollar amounts, $2.4 to $2.5 trillion spent on health care in the past year. Our per capita health care cost is double that of virtually every other developed nation in the world, nations we compete against every day. And as we come out of this recession, and American business has to compete against these countries around the world, American business is hobbled by costs that on average include $3,000 more per employee due to our higher health care costs than our competing nations. If we look at an issue that is equally important, and one that I know my colleagues, especially my freshman colleagues, have continued to raise, but we hear from our friends on the other side of the aisle, concerns about our federal deficit. Well, the primary cause of our federal deficits and our overall debt is the increasing per-person costs of Medicare and Medicaid. We pay more and more dollars in the federal budget each year to basically pay for the same level of care. And as this chart shows, increasingly, Medicare and Medicaid costs alone will exceed all of the other spending within our federal spending. Clearly, this situation is not sustainable. In my home state of Virginia, since 2000, insurance premiums have increased nearly 90%, while wages have only increased 27%. If we do nothing, and this was reconfirmed by the Business Roundtable report nationwide just last week, Mr. President, insurance premiums are projected to double by 2016. This is particular concern to small businesses. Today, small businesses are the only group who still pay retail for their healthcare services. Their size makes their bargaining power weak and makes them susceptible to enormous increases in healthcare premiums. Once again, it's a policy choice. Doing nothing means exploding our federal deficit. Doing nothing means doubling the healthcare premiums costs for American families. And doing nothing means that American companies will be less competitive in a global market, and our small businesses will continue to be challenged to meet their basic needs. Mr. President, I think I speak for all my freshman colleagues when I say we were not elected to do nothing. I think most of us didn't run for office because we were satisfied with the direction of our nation. We were elected to work together with willing Republicans and Democrats to help turn this country around. I hope this will be a first in a series of statements from the freshman class who are not only here to point out the challenges we face, but to join senators from both sides of the aisle in committing to get things done.